So these are some of our resources as part of the Institute of Leadership. We have a 2-week online orientation, the RCSI online library, reference guide, assessment guidance, Grammarly subscription, LinkedIn Learning, academic writing and support. As I mentioned, we have bases in Dublin and Bahrain and UAE, but we have student academia or academic directors and students from all over the world, as you can see on the map here. So before we get started, as I mentioned, I'd be grateful if you could please mute your microphones, turn off your cameras. You will have the opportunity to ask questions at the end of the session, but if you do have questions throughout, just pop your questions into the chat box. So now I'm going to hand the microphone over to Professor Robert McMurray, who will talk to you now.
Hello, everyone.
Robert.
Hello, thank you for that. Thank you for joining us today. Really appreciate it. I don't know if we can we switch from the slides just to me for this section, if that's all right.
Sure.
Thank you. So as you can see on the slide, I've been here since January 2021, and it's been a real privilege to be here. Before, I've worked in business and management schools more broadly, mostly in the UK, and I came to the Royal College because the challenge of healthcare and healthcare organising has never been more important. I think the COVID-19 pandemic has shown us what managing and managers do, and that even with the great science that we have and the vaccine technologies, what fundamentally matters is how we manage those experts, how we manage our resources, and how we put things together, how we provide leadership to our teams and to those people who we charge with looking after local communities, countries, and global populations. Management, organising, and leadership are really, I mean, I'm biased, it's what I do for a living, they're really exciting subjects. You cannot do anything meaningful without collaborating and working together. And that's particularly the case in healthcare. We've got kind of grand challenges and wicked problems that span the boundaries of health services, education, housing, national policy, and indeed international boundaries. And if you're involved in that, if you're part of managing other people, if you're part of leading other people, it matters how we guide them, direct them, and care for those who work for us. It matters how we engage stakeholders, both traditional ones and new ones. It matters how we deal with change, whether it be in systems or processes, relations, technology, conflict, disruption, negotiation, and innovation. And I dare say you've all had a lot of change to deal with over the last 12 months in particular, though, you know, as we know, change is actually an ever-present. We see a lot of change models where it looks like you can freeze and unfreeze things, but as Heraclitus suggested, you can't step in the same river twice, and life is like that. You may stop, but the world just keeps flowing by. And the question is, how do you go about coping with that? How do you go about finding models that will help you better understand the world around us? And that's what we're about. We're about employing the best in new ideas and theories to really look at how we manage better. And what we're really kind of about is the critical application and thinking in relation to that. There is no such thing as an inherently good theory or an inherently good idea. It needs to be tested. And that's what we enjoy, working with people such as yourselves to bring ideas, bring theories, bring concepts, and have you test them in your particular places of work, in your particular problems, and come back to us and say, do you know what, that doesn't work. We're really happy to hear that if we've put something forward, you come back and to say you don't think it works or it needs adapting. The key bit to that is why. And here at the Institute, we really are about that kind of thirst for questioning and why. It's something all of us were really good at when we were kids. If you've had young children or remember being a young child, you'll remember that in those early years, once people can talk, all they do is ask why. As a parent, it can drive you insane. You know, Why is the sky blue? Why can I do this? Why is someone allowed to do that and I'm not? Why do I have to go to bed? Why is the earth round? And on it goes. Now, over time, there's a danger that we stop doing that. We stop asking that why question because we're trained through examinations or the politics of organizations not to ask difficult questions. But I think that's exactly what good managers and leaders do. We're willing to ask difficult questions. We're willing to show that we may not know the answers, but we're very willing to learn, and we're brilliant at asking the right questions. And often the right question is more important than the right answer. So I suppose what I'm saying is it's really important to think about the nature of our managing, organizing and leading, both in general terms and in respect of individual practice. Our role here at the IOL is to support you in that and to challenge you in that, whether you're with us for an hour, and again, thank you for your time today, or, part of one of our diploma or master's programs. We really do try to uphold the university's mission to educate, nurture and discover as a unit dedicated to leading healthcare management. Most of all, we're interested in you. We want to get to know you better and your worlds, and we love learning from you and the experiences you have and bring to bear, combined with the knowledge and expertise we have. And talking of experts and expertise, you've got a great session here today with Dr. Walsh. Now, Dr. Walsh is going to talk about service innovation in global health, and so I'm definitely not going to tread into that area. But yeah, I mean, innovation is such a hot topic. Again, despite the tragedy of the pandemic, innovation has been at the forefront. Just to take one example, I remember talk of the potential and the spread of telemedicine when I was an undergraduate. I'm sad to tell you, it was a very long time ago when I was an undergraduate. But really, telemedicine has always struggled to take off, to get moving. We see a crisis, we see a major change, we see a pandemic. Telemedicine in primary care, for example, has never had a more important impact and never such a great growth. And what's really interesting is it wasn't necessarily dedicated apps in terms of those developed for healthcare professionals that were important. It was apps like the one we're using here today. It was Teams, it was Zoom, it was Google Hangout. So I'm sure you're going to really enjoy today's session. Thank you again so much for your time, and I'm going to leave you in the excellent hands of Dr. Walsh. Thank you.
A big thank you, Robert. Thank you for the introduction. A very big welcome. Amy, if you can just upload the slides for me, please, before we get started, that would be fabulous.
Sure, no problem.
Thank you. So a very big welcome to everyone today. We're absolutely delighted to have participants at this webinar from all parts of the globe. So we are delighted and give you a big welcome and a big mahaba if you're from Arabic speaking countries. My name is Dr. Clare Walsh, and I am the Programme Director for the Masters in Healthcare Management. Before I go any further, can I just ask, can you hear me well, and can you see me? Just perhaps a little thumbs up in the chat would suffice. That would be brilliant, just that you can hear me and see me. Okay, so that's brilliant. I'm seeing thumbs up and hands up. That's fabulous. Great. Okay, so today's session, and a big thank you to Robert for the introduction, very kind words there. And I'm just picking up on a term coined by Robert, grand challenges and wicked problems. I think I'm going to use this in future, quite nice wording and terminology. So, like I said, today's session is, we're looking at service innovation in the global health sector, opportunities and challenges. So I'm hoping today what we're going to do is the following. So let me just take control of the slides. Right, so we've got two key things that I would like us to do today. Is we want to look at identifying service innovation initiatives. So what are service innovation? What does it look like? And I'm hoping that you're also going to help me with that. And secondly, then we'll look at what are the opportunities and challenges of service innovations. And Robert very kindly kind of lended himself to this idea of telemedicine and where it's come from and where it is today. And we know in the last year there's been huge uptake of telemedicine as a service innovation, if we like. And here in the IOL, we've seen numerous year 2 projects from our master's students actually investigating and looking at elements of telemedicine being explored for those year 2 projects, dissertations. So we're at the heart of it all here. So before we get started, if I could ask, just where's everyone from? I know that I'm saying good afternoon to some people, I'm saying good evening to others. I'm based in Bahrain, so a big hello to everybody in the Middle East. So hello to everyone in Bahrain and UAE. Great, Nigeria, hello. And where else? Kuwait, Pakistan, Ireland, Nigeria, brilliant. Nigeria again, fantastic. Well, we've got really, really diverse participants today. Fabulous, and a big welcome to you all. We're delighted to have you here. So let's move on. So what we're going to try and do today in the short time that we have is to really look at some of the definitions and concepts that we that are kind of aligned with the term service innovation. We'll look at some examples of service innovation in healthcare, and then we'll kind of investigate an example of a service innovation where we look at the spread of primary care groups in the Netherlands, where we take a closer look at the ZEO Care Group as kind of an example of how service innovation happened in that case. I'll also be asking you at times to maybe come in with your own examples and of service innovation, and I'll be doing that in a few minutes once we've had a chance to kind of explore what we mean by service innovation. So thank you all for your introductions. I see names and places, so wonderful to see so many people from so many parts of the world. It's really wonderful to have everyone here today. So if we just consider this idea of service innovation, like how do we define it? What does it look like? So we can simply see on the right-hand side of the screen, we have service innovation being defined as a novel set of behaviours, routines, and ways of working that are discontinuous with previous practice. Okay, so we're making some changes in our behaviours, some change in our practice, and our ways of working that are not the same as before. And these changes in our service innovation are aimed at improving health outcomes, maybe administrative efficiency, cost effectiveness, or user experiences. So that's really the aim of these service innovations. The key thing here is that the introduction of service innovation is just not one event. It's not introducing telemedicine, for example. It's a whole series of implementation processes that need to happen. So I think that's very important. And just to put this into context for you, I'm going to give you an example of a service innovation from a Florida hospital. So the situation in a hospital in the Martin Health System group in Florida was we had nurses in an ED. I could not locate IV pumps in a timely manner, and it was an ongoing problem. So the kind of analysis of the situation demonstrated a 30-minute kind of per shift was spent looking for equipment. Some nurses even hoarded equipment, which led to perceptions of shortages as well. So kind of two problems were at play here. So they actually had excess of the IV pumps, but because of the hoarding, there was kind of a perceived shortage as well. So really what the problem was here, there was a lacking of an efficient system for nurses to actually obtain equipment. That was the actual problem. So the service innovation here was to install what they called an equipment supermarket to stock inventory. This system was color-coded with color-coded shelving with quantity of items for each color. So shelving that was green showed an adequate supply. The yellow colouring was a kind of reminder to replenish the stock soon, and then the red colouring on the shelving was to restock immediately. So what this kind of indicates when it was implemented was that it enabled nurses to spend more time on patient care and less time looking for equipment, because now it was easily available, easily accessible, and always in stock. So this kind of exemplifies the essence of service innovation, a service process that offers a new way to deliver an existing service. So that's really kind of a nice, kind of straightforward example of a service innovation. So if we move forward and consider these examples here, and I want you just, while we're going through this kind of set of examples, maybe think about these examples from your own practice. Are any of these things evident in what's happened in your own professional setting in the last year or in previous years? So some of the key elements that we see when we're, adopting some novel sets of behaviors, routines, or ways of working, is, this type of innovation falls into kind of a lot of wide-ranging categories. So we might look at new technologies, such as digital technologies. So, for example, mHealth or telemedicine, for example. We might look at new procedures as a service innovation. So, for example, minimally invasive surgery. We might also see creation of new rules as a service innovation. So perhaps nurse practitioners in primary care. Or perhaps we might consider the relocation of services from hospital to the community as service innovation. We also might look at the creation of new services. So for example, case management. Or the introduction of new models of care, so like an integrated delivery system. And we'll have a little closer look at that through the ZEO Care Group case in a few minutes. The key thing is, all of these things, they have significant impacts on ways of working, so on the way on how we work. So that is probably the key thing that we need to take away. So what I'm going to ask you to do, just thinking of those examples, perhaps share with us from your own professional practice and your own settings, is there any examples of innovation in service and delivery and organisation that you've experienced in your professional setting? Was there anything that made that innovation particularly successful, or were there any challenges that existed? So great, I'm seeing examples coming in there, so let's have a quick look. So let's just take a moment and share some practices from across the world. So let me see, we have Dr. Momo, thank you so much for sharing. Mimi, you did something similar in the UAE. Let me go back up and have a look at some of the others. Go down. Okay, so any examples you have? Okay. Okay, so Dr. Burnett, you said that you've used online platform for teaching. Fantastic, that was a change. And let me see, Mimi, you're saying you use case management with a success story. Fantastic. And Mimi, you're referring to that from a UAE perspective.
Hi, can you hear me?
Yes. Yes,
so,
Mimi.
yeah, actually we had quite a few innovation and it's been success stories in here. Yeah. One of them is like we look on utilization management, in particular on underuse and overuse in OT services. We had the full kind of process looking on where we kind of use the over services, and basically we look on our staffing, we look on OT, like the room what to use, we look on a procedure. So we put our case together. And of course, we decided after that to kind of, relocate and schedule the surgeon to do procedure like for an elective procedure in certain day, to have room specially only for emergent procedure. So that was working very, very well up till now. So it's been already 2 years since we implemented. We're developing all the policies and procedure. We had to adhere to that. We kind of done training on it. And the second one, what we did prior to JCI, we kind of had the old emergency department, and we commissioned the old emergency department into the new wing. So we kind of, when we moved, we had the storage system. Basically, we just kind of put it somewhere, and it geographically was kind of not very staff friendly, what you just mentioned. Also, you know, having a store marketing unit. So what we did, we kind of look in terms of how we're gonna position the store for the team to kind of be able to utilize it, especially for the red zone area, for critical care area. So yeah, we created 2 store units. We allocated the staff to work in there. We do kind of checking. I mean, we don't have the labeling because it's a very busy emergency department, and we have lots of stuff. But we kind of have like 24 hours staff which is available for restocking, and it's working amazing. I mean, it's very good.
Excellent. Thank you so much for sharing that example from UAE. Mimi, is that correct? You're in the UAE?
Actually, in two government hospital. I'm a quality manager, and we have 2 government hospital in here which are very close to each other. And innovation is a part things in the UAE. So I think we drive innovation in everything what we have to do.
Brilliant. Thank you so much for coming online and sharing your examples with us. And just while you were sharing your examples, Mimi, I was having a quick look through some of the examples in the chat function, and I've just tried to, there's many of them, so thank you all for contributing. I'm trying to summarize them, and what I'm seeing is some telemedicine examples, so thank you for that. Also seeing some blended learning approaches for training, and also seeing some simulation examples and home medication services. And I know from the Middle East that's been really popular here in UAE in particular. So thank you for sharing those examples. And again, you may have more as we go along. So thanks for those great examples and for sharing them here with our participants today. So we have to consider, Mimi, you gave us great example there from your own professional setting, and you mentioned JCI as kind of one of the factors that were going on. So I think we said earlier, service innovation, it's just not one event, it's a whole series of things that have to happen and be implemented. So we have to think about the factors that impact on us and that lead to successful implementation. And I've highlighted some of these here on the slide. So we have 6-7 of these here. So just going through each of them briefly, we'll look at a factor for successful implementation includes leadership and management. And what we're referring to here, and it kind of goes back to what Robert said in the introduction there, you know, really important to have that leadership and management support. So we need leadership at different levels that are supportive and committed to change. That's really important. And you know, leadership that's articulating a clear and compelling vision. So really that's one of the key things that we need to see from the leadership and management perspective. From a stakeholder involvement perspective, really what we're seeing from the literature and the research argues that really we want to see stakeholders that are involved early, and it needs to be widespread involvement. So what we see that means that we need to include staff and service users as part of that stakeholder analysis and that stakeholder group. When we look at resources as a factor for successful implementation, again, the literature and the research would say, you know, we need to be adequately resourced to be successful for that service innovation, successful implementation. So we need to make sure that we have, of course, dedicated and ongoing funding. Okay, we need to make sure that that funding is there for this service innovation to happen. We need dedicated and ongoing resource support for staffing, for the infrastructure, and of course time. So they're really important resources that need to be thought of in the implementation process for a service innovation. Communication is really important. Again, we need to see a concerted communication plan that's disseminated across the organisation and includes all of our key stakeholders. Local context. We know we're from all parts of the globe here today. We know our own local context will be really important, whether we're based in UAE, Bahrain, Kuwait, Pakistan, Nigeria, Dublin, Ireland, Europe, US, wherever that may be. We know our local context is important in the sense of what do our local rules, regulations, culture and politics have to do with the influencing of how we implement successfully. So we know that piece is really, really important. We also have this idea of monitoring and timely feedback. So when we're thinking about monitoring and that we're observing what's happening, we're managing and monitoring what's happening, but we also are providing timely feedback about the progress of the implementation. And then finally, that evaluation piece. And we know in healthcare, we're very interested in evaluating the impact of our projects and of our service innovations. So when we think about evaluation, we're looking at the cost effectiveness. So we'll see service innovations that might have a cost effectiveness evaluation completed. We might be looking at the assessment of the health benefits. And again, there's a whole world of research that looks at evaluation as well. So again, they're kind of factors for successful implementation. And when we look at the ZEO Care Group, we see that evaluation was a really important part in the expansion of the ZEO Care Group from a smaller diabetes disease management program to something that was wider and more freely available across the Netherlands, and we can see how evaluation helped with that. So they're kind of important aspects for service innovation when we think about factors that are important. So if we consider then the ZEO Care Group as kind of a more detailed example of the spread of primary care groups as a service innovation. So the ZEO Care Group is based in the Netherlands. Just a little bit of background before we look at the actual care group as it is today and how it evolved to be where it is today. Came about as a result of a pilot project by Maastricht University Medical Center, and it was really kind of based on a diabetic disease management program, and then subsequently morphed into and moved into a full primary care group, which we refer to as ZEO today. It was financed through statutory health insurance using bundle payments for defined chronic conditions. So that's kind of a little background to that case. Now, I am aware that someone said earlier you couldn't really see the slides, but I know this has been recorded and you'll be able to get a closer look at these slides. But just a little bit of detail about the model, the ZEO Care Group, kind of the model, the system, and how it looks. So it's the model for ZEO Care Group is it's an integrated primary care group targeting patients with specific NCDs. It was established through the pilot and then formalised in its current format in 2007, and currently, recent figures at least anyway, has about 25,000 patients that are enrolled. The system itself is universally mandated private insurance, regulated and subsidised by government. It's primary care delivered through the private sector, and the GPs then act as gatekeepers to secondary care, with physicians remunerated through a combination of capitation and FFS. So what we mean there by those terms, which mightn't be familiar to everybody, is capitation is this idea of a type of healthcare payment system in which a doctor or hospital is paid a fixed amount for the provision for a patient for a prescribed service, and then our FFS is our fee for service, is a payment model in which doctors, hospitals and medical practices charge separately for each service that they perform. In this model, the patient or the insurance company is responsible for paying the required amount. So the innovations that we see in care as a result of this model then, because we are talking about service innovation, was the innovations in care. So we saw tasks shifting to specialty nurses. We saw bundled payment contract for defined packages of care. And then we saw stratification of patients based on specific parameters. The outcomes then, and this is where our evaluation piece comes in, was a 54% decrease in hospital admission costs for patients assigned to specialty nurses, and then a 15% decrease in proportion of patients with poor glycemic control. So that was kind of what the model looks like. but we need to know, how did it get there? How did it get from a pilot project in 97 to what it is today, in the sense of these kind of key descriptions that we've looked at, in the sense of a model, a health system, the innovations that happened, and the key outcomes as a result of that. So let's have a quick look. So what we see then is the ZEO Care Group evolved from what was deemed to be a local programme, so the Matador Disease Management Programme, which was developed by Maastricht University, a regional GPs association, a health insurer, and the Maastricht branch of the Dutch Diabetes Association. So the innovative components of the Matador model included a team approach. So what we saw here was the diabetes nurse were linking primary and secondary care, and they were taking on some of the tasks previously performed by doctors only, and the use of protocols, setting out the primary responsibility of 3 subgroups of patients to a medical specialist, which was highly complex problems, a diabetes nurse for intermediate or stable situations, or the GP and a practice supporter for those low complex, and support of self-management. So that was really kind of the original program, and how it then evolved into a wider program. So one of the things that we saw, and when we go back to some of our factors for successful implementation of service innovation, was this idea of evaluation. So the Matador program was extensively evaluated. The key attributes of its success were the integration of the various levels of care. Again, going back to our factors, if we go back to that slide we looked at a few moments ago. So the levels of care, the strong leadership. Remember, we said leadership and management are core for a successful implementation. The shared vision. So we saw here a shared vision about the care delivery. Again, that factor of communication and the transparency regarding the program's objectives were key. The program then was described as a prime example for a well-developed disease management for diabetes, and it was disseminated as a so-called Maastricht model across the Netherlands. So again, trying to expand the model. So the service innovation here, we're going from the Matador model to expanding the service across a wider part of the Netherlands. For the model to be acceptable amongst the GPs in the Netherlands and to be more widely recognised, it was redesigned. So what we saw here then was the GP and primary care in general was tasked with primary responsibility for the subgroup of patients with intermediate complex care needs. Further adaptations then were brought into place, and they included GPs employing practice supporters who may or may not have had a nursing background. What this did was imply a different role for diabetes nurses, who became a consultant for primary care and caregiver for patients with those highly complex care needs. And then the wider uptake of the program was further stimulated and facilitated by supportive measures, such as the introduction of the bundled payment system for care groups from 2006. So again, kind of reminding you to go back to those things that we looked at on kind of that slide before we shared our example. So this idea of, effective communication, evaluation, monitoring and feedback. So they're all at play here in this case of ZEO Care Group. So I'm just mindful of the time. I do know that we have Miriam coming in after at the 15 minutes past the hour. So I'm just going to move on to some of the opportunities and challenges. So some of the key points, and these are not me making it up or guessing, these are all kind of founded in the literature and founded in service innovation research and healthcare service research. So, I mean, this is what the research is telling us, that the processes involved in introducing innovation range from adoption, implementation, sustaining, spreading or diffusion, dissemination, and then scaling up. And the key thing here is they overlap in complex ways. It's not as straightforward as we'll just adopt something and we'll implement it. There's so much complex interaction between these various components that, service innovation, it's not straightforward. It's not a simple linear process. So all of these steps have various complex interactions. Again, what we see here then, innovation in health services really involved the development, introduction and mainstreaming of new technologies. And we've seen great evidence of that in the last 12 to 18 months with responses to COVID. So what we're seeing is traditionally perhaps telemedicine had, a high failure rate for its implementation. However, that kind of idea of imposed service innovation as a new term in the service innovation research field is where we're seeing telemedicine really coming to hand and coming to play within healthcare. And like I said earlier, we've had numerous examples of telemedicine and telehealth in our year 2 projects here on the Masters this year in particular. So again, service innovation, again, I'm just referring back to that term, imposed service innovation. Again, we're seeing that bandied around in the literature as a kind of a newer term. What we're seeing then is physical distance innovations, wearables and devices coming into play to say ensuring that we don't have to touch door handles, for example, in a healthcare setting. So we conceive those at play as well as important components. Now, this is a really for anybody who wants to kind of investigate a little bit more. This table is from a seminal piece of work completed by Tricia Greenhalgh and others. If you just do a quick Google search, Greenhalgh and service innovation, you will find her systematic review. It's been cited, I think, over 7,000 times. But in there, that systematic review will kind of really, she has explored extensively kind of the key characteristics that are important within organizations when we're trying to adopt, implement and sustain an innovation. And really, I'm not going to explain all of these in detail here, but if you do want to go and explore this in more detail, she has identified these particular characteristics. So she said in her work, it's the characteristics of the innovation. There's characteristics of the intended adopters. We've got organizational antecedents that need to exist. We also have aspects of organizational readiness. We have a wider system context that needs to be considered. We've got this idea of diffusion and dissemination. So how do we diffuse what's happening? How do we disseminate what's happening? And then we have implementation processes. So like a really, really good piece of work to go and explore if service innovation really captures your attention. So some really kind of key points in there. And, a lot of those will make a lot of sense to all of us. Whether you're in a healthcare setting, a research setting, an academic setting, we know that, wider system context like your socio-political climate's really important, that your environmental stability are sort of contexts that need to be taken into account when we're doing service innovation. So do have a look for that paper if it's something that captures your interest. So some of the other points to consider when we're thinking about service innovation, I'm going to try and wrap this session up now in the next 3 or 4 minutes. So key points. If we're arguing for a service innovation within a healthcare setting or professional setting, there's some things that we really need to consider. So we might look at this idea of, is the innovation worth introducing? So what's the value proposition here? What's the value proposition of introducing this? And when we're thinking about a value proposition, we want to also pay attention to who would benefit from this particular innovation, but also we also need to consider how do we minimize what we call those unintended consequences. So for example, we want to make sure that an unintended consequence such as excluding marginalized populations doesn't happen. So we need to think about the value proposition. We also might want to consider, and be aware of competing or complementary innovations, and that could be internally or externally. Because if we have competing innovations, what we can see is perhaps, disengagement or fatigue amongst stakeholders, or even uncertainty. We know this idea of context, it's key, really, really key to consider. So we know the successful implementation, sustaining and spread of innovation requires a broad range of interventions that need to happen. and continuous adaptation to the changing service. So we know that as these changes are happening, we need to really never let go of the political, the cultural and institutional aspects. Time is really important. So we know that we need time to learn. So to learn and to function in new ways, because often a service innovation might require the use of new technology, for example. So if that's the case, we need to make sure that there's time made available for the users, so the professional members of staff who have to perhaps use a new service or provide a service using a new piece of technology, that they have the time to learn how it works. And then finally, like longer term, and we talk about sustainability, we think about the benefits of innovation. So can the innovation be widely distributed? Is it sustainable? And will it ultimately meet the broader needs of society? They're kind of some of the kind of social order questions we ask ourselves when we think about benefits of innovation. So there's some of the key points to consider. When we think about challenges, so interestingly here, what we see is that the research, the world of research here, when we look at service innovation research and we look at health services research, we know that there's an absence of longitudinal studies that look at evaluation of service innovation over time. So there's a real kind of call out there for, longitudinal studies, so studies over a length of time where things like the role of power relationships between different stakeholders are investigated. And doing these types of studies helps us to better understand the impact of those factors, for example. Also, there's a greater need to understand the systematic assessment of strategies that work well in combination with context and conditions. So this is this idea of in what circumstances do things work and not work, and who do they work for and why? They're the sort of questions we might ask ourselves. And again, more of that work needs to be done. And really importantly, we're here today, we're from all parts of the world. We know that service innovation in one setting might already constitute routine practice in another one. So we have to be mindful about translating an innovation from one health system to another. And again, policymakers, they're faced with these challenges as well of translating innovations from one part of the world to another, from one country to another, even regionally, where you have to look at what does the regulation look like, what does the funding look like, and what does the delivery of healthcare look like. So they're really important challenges that exist when we think about, adapting innovations from one healthcare system in one country to another. And then finally, we know the literature also says that maybe health services research would benefit from maybe more attention from improving the marketing of services, for example. So we see, for example, services that people kind of really need but may not actually perhaps want or desire. So how do you market screening tests such as mammography or colonoscopy, for example? And also researchers can also learn lessons that inform future innovations by linking what's known from maybe the field of marketing and management and kind of using some dedicated analysis to inform kind of healthcare innovations, particularly those that have not succeeded. What can we take from other fields to enhance application in a healthcare setting, for example? So that kind of is a very whistle-top tour through a service innovation with a focus on healthcare and the global healthcare, and looking at some of the kind of challenges and the opportunities that exist, but also kind of looking at some examples as well. And also, you all were great participants today, bringing in your examples from your own professional settings. So thank you for sharing. So thank you very much for this opportunity today. It's been lovely to be able to share these thoughts on the screen with you for service innovation. There's some references there should you wish to explore any of these in a bit more detail. And Miriam, I believe I'm going to hand back to you. Is that correct?
Yeah, absolutely. Thanks so much, Claire. That was really interesting, and it's great to have these webinars and kind of like spark the interest in these discussions. As you all know, like there's more to come. This was just a little teaser for what we do in our master's programs, and this year as well, just because of COVID, I suppose last year we moved online, and this year we're going to be online as well, which is a great opportunity to kind of have more international students and kind of have more discussions like of all over the world about healthcare and how people do things in different ways. And it's actually great. So it's great to have so many people from so many different locations here today. But we do have lots of courses, and we will be. Can you see how to apply there now on this site?
Yes. Yeah, we can. Perfect. Thanks, Miriam.
That's perfect. So we do have lots of courses. We have 3 masters and we have 3 professional diplomas. They're all level 9. And today I'm just going to, some of you have already applied for courses, some of you are thinking of applying. So basically we have an application. You can pop onto our website. So it's rcsi.com/leadership. And then you can go to the study section. We have a little study section up on the top bar. You just pick your location. And then we can go to the apply tab on the course page. I just picked the Masters in Leadership and Innovation in Healthcare there. So you'll have your course details, entry requirements, fees and funding, and your apply button. Once you go to the apply button, you'll see the details how to apply. It'll bring you to an application, and there's also a video underneath on that page of exactly how to do it. So if you get stuck, you can have a look at that. We do have a few requirements. There's a document upload section as a part of our application. It's basically like a questionnaire the whole way along. You can pop in and start the application and pop back out if you want to continue at a later time. So I suppose if you have any questions about the courses themselves and any of the applications, anything like that, you can just let us know. That's no problem at all. If you want to pop on your mics or anything, if you have any questions now at the moment, you can just let us know. Or you can add them to the chat as well. Any questions? Even if you have some questions for Dr. Clare Walsh about her talk there as well, you can pop them into the chat. If you don't, yeah, so we have someone's hand up there. You can just pop on your mic and let them through.
Okay, hello. Hi, this is Dr. Memuna from Pakistan. Thank you for this. This was excellent. Thank you for giving this opportunity. The question is that even if we apply for the course, like as middle managers, as top managers from anywhere else in the world, what are the career prospects? In the end, we are just, waiting to work globally. And then with all the restrictions that are around, I don't want to personally, and I think that many would agree, we want to progress in our careers as middle managers at this stage of time. So can we have some information, because this is really unique degree, on how, we can move forward, like with top positions in WHO, with UN organizations, how can we move globally? So how do you offer any internships, things like that? So
yeah, so we actually have an upcoming webinar. We're actually getting alumni to come on and from all of our courses, and they'll be able to kind of give you details on what they did, what they progressed on to do, how their projects kind of helped them in year 2 from progressing where they got to. We actually have a lot of our alumni that actually get promotions while they're on the courses as well. So that's a really positive point. With regards to career prospects, we have the Institute of Leadership is great because we actually cover healthcare professionals across the board. So we can't say like once you do this course you're going to go down this route, or this route, because we have so much variability with the students that come on our courses. But we're like, I think you should definitely attend the upcoming webinar. It's going to be in July with all our alumni. I think that'll help you kind of gain some insight into kind of what they got up to, how they got to where they are, and you might get a little bit more information in that sense. But yeah, definitely this year we have a lot more students from international backgrounds and stuff like that. But then again, we do have an international team of academics here, and they have they have loads of experience, and they have an amazing background teaching in lots of different locations. So we're very grateful and that we have that kind of information behind us. So yeah, I'd be definitely, you'll get emails for the next webinars anyway, so I definitely will come to that one. And if you have more questions after that, the Q&A session for that day will be brilliant. So I would definitely go to that. But if you do have any more questions, just let us know after that, and we'll try and help you. Okay, so we have some coming in on the chat. So internship options, we actually don't do them, but again, like hopefully you'll get more information and stuff like that from the alumni webinar, which will be really, really good. Is there support for placement globally? Again, that's the same. The placement and kind of the after your course is up to the students, but we can help with in year 2 for the master's programs, there are year 2 projects. So like this can be like a platform for you to kind of like look at where you want to go and how you want to do your you like say if you wanted to go for a new job or different things like that, how would you do your project kind of like push you in the right direction? And in year 2 you don't only have just the program directors, you have your program coordinator and you'll have a supervisor as well, which is like really helpful, and you'll be all in groups as well, so that's a really good support system that you'll have all throughout year 2, so don't worry too much about that. Same again about the career prospects. We have healthcare professionals across the board, so the career prospects kind of vary. It's not just like doctors, nurses, it's healthcare professionals all the way across. So it'll just depend on what area you're working in. But again, I would advise to come to the alumni webinar where you'll hear lots of information from them. It's really insightful when you actually hear it from the students. So that'll be it. So how many online hours are required per module and how many assignments? So I'll answer the first part first. So for any of the level 9 courses, each 10 credit module it's advised as 250 working hours. So that's like everything, but like you have to take into consideration, like if you have loads of information on a particular module, it'll take you a lot faster to go through a module than it would for someone else. We do have the timetables available on the course pages online, so you will see for the master's programs there's a start date, and this start date is the release of the module date, and then there's 3 lecture days per module. And so what this means is you'll have half days, 2 days back to back, and then a follow-up day the following week. So that's the layout of the masters. The professional diplomas are slightly different. You'll see there's more webinars, but they're actually they're 1-hour webinars, and then there is a kind of online workshop day, so that'll be 2.5 to 3 hours, and that's the way the professional diplomas work. But if you have any like questions about the timetables on that, you can just let us know. To answer the rest of your question, how many assignments? So there's, for all the courses, there's continuous assessment. It's a mix of group and individual assignments, and then for year 2 you'll obviously have your project if you're doing any of the master's courses. And then what type of exams? There is no exams yet. There is no exams, and if there is, you'll be you'll be informed. But as of now, there's no exams. It's all continuous assessment. Will you be able to practice in the different locations? So someone asked, will I be able to practice in Ireland, Canada, Europe with the Masters in Quality and Safety in Healthcare Management? So our courses are all accredited by the National University of Ireland. So that's a global recognition. Depending on the organisation that you approach, it'll depend on their criteria, but we are accredited by the National University of Ireland and the Royal College of Surgeons, so you'll have an internationally recognised qualification. What's the difference between the Masters in Healthcare Management and the Masters in Leadership? Well, we're lucky enough to have Dr. Clare Walsh, who's the Programme Director, on this call today. Clare, would you like to give some insight into the differences in the Masters in Healthcare Management and the Masters in Leadership?
I sure will. Thanks, Miriam. Just coming back online here, just let me get my camera back.
No problem.
Yeah, it's a great question, and I'm still not got my camera. Here I am. Okay, yeah. So the difference between leadership and healthcare management. Okay, so really they're fundamentally about the areas of study. So within the obviously leadership really focuses on all of the key components of leadership. We look at leadership within the healthcare management, but only as one module. the rest of the modules within healthcare management are broad. So you come away from healthcare management with a broad set of skills and knowledge. So say, for example, we look at the opening module for healthcare management is around organization behavior. The second module looks at operations management. The third module is strategy and leadership. The fourth module then is managing finance in healthcare organizations. The fifth then is quality and risk management. And then finally, the sixth is our research methods module, if you like, which you start in year 2. So that's really the key distinction is you come away from leadership with a whole set of skills and knowledge really dedicated to the field of leadership. Healthcare management is a much broader animal. So you're really coming away with a set of skills that look at quality, that look at risk, that look at operations, that look at organization behavior. So really, it's for someone who wants to have a broader and wider set of skills that can be applied in really a broad set of roles across the healthcare sector. So that's really the distinct difference there. Yeah, I hope that answers your question.
Yeah, definitely. Thanks for that, Claire. I suppose touching on this question is another question that followed. What's the difference between a management master's and a master's in healthcare management? Do you want to take that one?
Sure, yeah. I mean, really, the focus, if we think, obviously, my background's at management, and when we look at healthcare management, then what we see is, if you took an MBA, so a Master's in Business Administration, for example, you would look at the broad concepts of management in very distinct fields, such as business, such as marketing, and so on. However, everything that we do in a master's in healthcare management is really focused on the world of healthcare. So it's specific to the healthcare industry, if you like. So with healthcare, it's really important to note what we're seeing is the principles and theories and concepts of management are applied to healthcare, and that's the distinct difference. Is we're looking at different theories, different concepts that are applied in the world of healthcare, and I guess that's the very distinct difference. So again, if you're looking to be a generalist and maybe not work in healthcare, you might pursue an MBA, for example. However, if you're looking for you want to remain in healthcare and specialize in healthcare in that world, well then your master's in healthcare management will give you that specific lens to look through when it comes to management. So that would be kind of the very distinct difference there.
And I suppose I'll grab you for one more question.
Yeah, sure.
There, Claire. So I suppose one person, I suppose they're directing it towards most courses, but you can answer for the Masters in Healthcare Management.
Sure.
How much of the content is included in public health versus clinical?
That's a really great question, and I see it there from Bonix, if that's the right
pronunciation.
Yes. So I think it's a great question. Obviously, we try to steer away from clinical work because in most cases people are clinicians anyway, not all cases, but some. So we are steering away from clinical, and we encourage people to not lean too much on their clinical backgrounds. Obviously, there's some aspect of maybe quality improvement projects that link in with clinical practice, but we do focus on, in the case of the healthcare management masters, and we do focus on the management side of the business as such.
Thanks, Mel. So we do have someone who was just asking, they said, I have a certain level 9 leadership. Can I use this to participate towards the Masters in Leadership? So yeah, of course you can. When you're applying to the course, there is actually a section for recognition of prior learning, and you'll just tick the box and we'll follow up with an application form for you. And what this is you can apply to be exempt from a module, but we just need all the information from you. It's a form when you're filling out the actual course application. Just tick the boxes and put in the relevant information then, and we'll follow up with you. So you'll need kind of the learning outcomes from the actual module that you completed, and then if they compare out to the ones that we have on the courses, we'll be able to kind of offer you like the recognition of prior learning. So that is possible. You just need to tick the boxes and fill out the information in the course page, in the course application. So we have, oh yes, so will the module have face-to-face sessions, or is the whole course online? And is this a part-time or full-time course? So all of our courses are part-time, and then all of our courses at the moment will be carried out online. So there'll be no face-to-face sessions. It will be all online, and the course webinars will be recorded apart from the group activities that will be on in the breakout rooms. So you'll be able to attend the webinars, and then you'll have the recordings after, which I find can be really helpful, because you can actually sit there and absorb all the information that you're taking in the class. And then you'll have the kind of note in mind to say, like, I have all the recordings there later if I want to look back on them. So that's super. How can we study? So that's, again, we have a virtual learning environment, and what happens is when you start the course, when you get offered your place and you get your application sorted, we'll be sending out IT credentials very soon for all our students who have been offered places already. And basically you'll be given access to Moodle, which is our learning virtual learning environment, and that has all your course details and all the kind of information you'll need. It has the little places where you'll need to upload your assignments. It'll have pre-recorded videos. It'll have all the information that you need, and that's where you go for the links to all the webinars as well. So that'll be your one-stop shop for all the course information and everything, and all your content for your modules. And there'll be a class forum, and you'll be able to communicate with your groups if you're involved with groups there. The program coordinators, if you're in groups, they'll make little group links for you, so you can pop in there and practice with your group and have little discussions and stuff like that. So that's no problem at all. Okay, so just getting back to some of the questions. I've answered this one. I'm a practicing specialist dentist, so what are the career options after the Masters in Quality and Safety in Healthcare Management? So again, like, I would highly recommend that you pop over to the next, I'm fairly sure it's the next webinar. Amy can correct me if I'm wrong, but it's the alumni one, and like, it's a great opportunity to go in there, have a chat with all the alumni, and see what the career as like opportunities were for them and stuff like that, because we have so many healthcare professionals coming on the courses. We can't say, oh, you're going to, like, if you do this course, you're going to go down this route, but there is lots of opportunity. Our courses are built so that they give you the skill sets and the tools to progress in your field. And I think that's really important, because it's not like a course where you're a teacher and then you become a teacher straight after. We give you skill sets and tools to progress in your field. So I think that'll be kind of an interesting topic to bring up with the alumni, and see how they got on and what they did with their projects and how they planned their projects to actually help them to achieve their career goals. So that is definitely something that you should attend if you're looking at that. Same with I'm a professional accountant working as a senior manager in health services. Would I be eligible for the Masters? Yeah, absolutely. So for our entry requirements, you need a level 8 degree and to be working in the healthcare sector. But we do take, if you want to apply and you're not sure, you can apply anyway. We'll let you know. We'll be able to have a discussion with you and let you know. That's no problem at all. And then would there be a module exemption for someone with a postgraduate in? So if you think you have recognition of prior learning, let us know in the application, and we'll be able to follow up with you and review all your documents. It's no problem at all. Like, the worst thing we can say is, like, unfortunately, no, this isn't the case, like, and we can't progress with your recognition of prior learning. But if you do have courses that you've previously done and you think you have a chance to, like, the modules are very similar or something like that, upload all the documents and tick the box in the application form, and that's no problem at all. We'd be more than happy to help. So any of the modules talk about marketing in healthcare. I don't think we talk about marketing. We might actually, Dermot might touch on something in the professional diploma and clinical leadership. Claire, do you want to bring in?
Yeah, I think that's a really great question. Yeah. We don't directly, within the Masters in Healthcare Management, have a module directly related to marketing. But what I would say to you, even if there's not a dedicated module to marketing, it is something that if you're really interested in it, that you could focus your year 2 project. If marketing is your kind of interest area, you could build a year 2 dissertation stroke project around some marketing aspect, if that captures your attention. But as I would say, within the 3 masters, the leadership, the quality and safety in the healthcare management, there's not one dedicated module to marketing right now.
And I think that's an absolutely perfect example of looking at your career goals and making your year 2 project work for you, and what you want to get out of this masters, because at the end of the day, again, this is like the perfect masters to mold into what you want at the end of it. It's kind of like we give you the tools and the skill sets and the networking abilities to actually mold it into your career goals and get to where you want to be. And I think it's really important to let us know kind of what you want to get out of the masters and stuff like that. And if you have any kind of confusion about what course you want to do and stuff like that, drop us an email. It's just up on the screen there now. It's the leadership@rcsi.com, and we'd be more than happy to have a chat with you. That's no problem at all. And we have one more question. When is the webinar scheduled to answer all the questions related to the Masters in Quality and Safety in Healthcare Management? We do have a schedule for all the webinars. I'll get back to you. If you drop me an email, and I'll be able to let you know, because I might get back to you on the exact dates. I don't have them there in front of me. But we'll be able to, like, if we can't answer some of your questions in the webinars, we're more than happy to link in with some of the program directors and get more detailed answers for you. I hope that helps. Perfect. Franco's going to give you a call and discuss things further. Do we have any other questions before we finish up here? And if you're not comfortable in asking a question here today, again, the leadership email is there. So Claire, I think you might be able to give us a hand with this one. What's the difference between module 1 and 2 with Masters in Leadership? I think we'll have a follow-up webinar for the other courses, so we might be able to give you a hand with them if that's okay. But I might link in, if you drop me an email at leadership@rcsi.com, I'd be able to link in with the program director, if that's okay, and just give you some clarity on that. Okay, I think we've answered most questions there today. If there is anything that you need to ask, drop us an email there. We're always going to be here for you. So I think that's it. Claire, thank you very much. I think I'm good to go.
That's wonderful. I guess, do you want me to wrap up then, Miriam?
Absolutely, let's go.
Miriam, thank you so much for today's event, as well as Amy. And we know that Franco is in the background. We didn't see Franco today, but Franco, I know you're here with us as well. So Franco, Miriam, Amy, well done on organising today's webinar. A big thanks to Robert as well for joining us, and a great big thanks to you all for being here. I would say, as a closing remark, you were all wonderful participants in today's webinar topic. So I hope you've been able to take away some key ideas around service innovation, and perhaps maybe consider what's happening in your own organisation with a new lens today. I hope that will be the case for all of us. In the sense of this topic area. It's been wonderful to be a part of this webinar series that the Institute of Leadership is running. And again, I know that you'll be able to link in with my colleagues, Miriam and Amy and Franco and everyone else throughout the summer. Please do kind of take heed of Miriam's advice. If you need further information, Miriam is your port of call, and Franco, they'll be able to direct you to, if they can't answer your question, they'll definitely direct you to the likes of myself, any of the program directors. While I'm the program director for HCM, I do have colleagues who do the same role for the other programs as well. So the diplomas or the other masters. So they'll definitely be able to guide you on any of those more detailed questions that you may have related to the programs. So it was a real pleasure today, and take care, everybody, and we'll see you all again over the summer. Thanks a lot.
Thanks so much. Bye, everyone.